So yeah, I'm going to talk about COVID-19 and the harm principle, the case of mask wearing, which those of you, well, all of you may know this is mask wearing is definitely in the United States and in Canada, and I think in other parts of Europe become something of a hot button political issue. And so the purpose of this talk is really to use that case to consider the role of the harm principle as a principle of public health ethics. To be clear, I'm a staunch supporter of mask mandates, especially when it comes to mask mandates requiring masks in indoor public spaces. I think that those are just there's a sort of obvious argument for those things. But really what I want to talk about today is how the harm principle actually has a surprisingly surprisingly difficult ability. It's surprisingly difficult for the harm principle to really explain what that case is. And that's going to be the main point of this, and to suggest an alternative if you want to accept a liberal point of view of public health ethics. So the harm principle, as you probably all know from John Stuart Mill on liberty, goes like this. It says, the only purpose for which power can be rightfully exercised over any member of a civilized community against his will is to prevent harm to others. Just as a sideline, I note that the bit about the civilized community is usually passed over in silence, although of course, if you keep in mind when John Stuart Mill was writing, this is sort of at the height of the British Empire, when lots of people deemed uncivilized would have clearly been having power exercised over them against their will by the British Empire, but that's a side note for this talk. So usually that part about the civilized bit is crossed out, and the idea is just that the only reason the state can rightfully restrict someone's freedom is to prevent harm to others. Now, this would seem to provide a really clear and easy justification for mass mandates. So for example, in a New York Times editorial, Paul Krugman argued that, well, these libertarians who are objecting to mass mandates, that's just silly because even libertarianism says, the government can intervene to stop people from harming others. But this reasoning is actually more complex than it seems at first. And there's two complications that arise. So the first is that the harm principle is a necessary, not sufficient condition for state intervention. It says the state can only intervene to prevent harm to others. The second complication is that the harm principle can be interpreted in more than one way. And so I'll look at those two complications in turn. So begin with the necessary, not sufficient. So the harm principle says the state should only restrict freedom, prevent harm to others, not that it should always do this. And to see the relevance of this, keep in mind that in many cases there are lots of risks of harms to others that are really small and negligible, and the state should not intervene to try to stop them. So for instance, stepping on someone's toe when you're getting on the bus, well, that's kind of a harm to another person, but it would be ridiculous to have, the sort of toe stepping police, going around and giving people tickets for stepping on other people's toes. The costs of such an intervention would be greater than the harms that they're aiming to prevent. And so by analogy, in a similar way, you should only go to the hospital when you're sick doesn't mean you should always go to the hospital when you're sick. Some illnesses are minor and don't require hospitalization. And this is going to be important in connection with the next point about two different harm principles. So here I'm going to label these the narrow harm principle and the broad harm principle. I'll point out that a very similar distinction in these two different harm principles is made by Marcel Verweij in a edited volume on public health ethics published in 2011, which he calls them the harm principle 1 and the harm principle 2. I like narrow versus broad because I think that those labels are just easier to remember and more sort of expressive of what the principles are saying. So the narrow principle says the state should only restrict person X's freedom to prevent that person X from harming others. So in other words, this principle is saying that if the state's going to restrict your freedom, it has to show that you are going to harm somebody else. It can't restrict your freedom just to prevent harms that might arise from things that you have nothing to do with. The broad harm principle, on the other hand, doesn't have this limitation. It says the state should only restrict a person's freedom to prevent harm to others. It doesn't matter who's causing that harm. You might cause it, someone else might cause it. It doesn't make a difference who's causing it. And these are going to be very different, these two different versions of the harm principle, very different in this case about mask wearing. So if you think about the risk that a single person who isn't wearing a mask, how much risk that person poses to others, in most places, that risk is actually zero, because in most places, even in places where there's very high rates of infection, most people aren't infected. So to take BC, British Columbia, for example, where I live, I think the number of active cases in BC was never more than 10,000. And throughout the pandemic, it's usually been around 5,000 in the whole province. And that's in a province of about a little over 5 million people. This means that on average, there was typically like 1 in a million people in the whole province were infected. And that means that the vast majority of people are not infected, and so posing zero risk when they're not wearing masks. And even if you just took the average risk that a person is posing to another person by not being masked, it's going to be almost negligible. And so that means the narrow harm principle is really going to have a hard time justifying general mask mandates. That is, mask mandates that apply to everybody. The narrow harm principle could justify a mask mandate that said, if you're infected, if you tested positive, then you have to wear a mask. But it's not clear how this principle could possibly justify a requirement that everybody who goes into some public space that's indoors has to wear a mask. Notice that the broad harm principle, on the other hand, though, can give a straightforward justification. And I think this is just the justification that Paul Krugman was thinking of in his New York Times editorial, and that is, well, if nobody wears a mask, then clearly that's creating a significant risk, right? It's creating a significant risk of harm to others, because even if it's only 1 in a million people there are only 1 in a million active cases now in BC, that number could rise exponentially if the virus just sort of spreads freely throughout the population. And so clearly everybody not wearing masks is a much greater risk and a significant risk that the government can legitimately intervene to prevent. Okay, so that's this key difference. So I think clearly here that if you're going to try to use the harm principle to justify the mask mandate, it's got to be the broad harm principle. And just to illustrate this, here's a picture of Mike Pence. And some of you might remember this if you follow US politics. Last year, you might remember that, and I forget exactly when this was, but it was fairly early in the pandemic that Mike Pence, former vice president of the United States, visited the Mayo Clinic in Minnesota. And there was a rule at the Mayo Clinic that every visitor, everyone at the clinic had to wear a mask. And Mike Pence showed up on this official visit and did not wear a mask, as pictured here. And later he was questioned by reporters at a news conference, well, why didn't you wear a mask? You knew they told you there was the rule. And he said, well, I get tested almost every day, so I knew I wasn't infected. And if you think about what his reasoning is, it's essentially the narrow harm principle. I'm not a risk to anybody, so therefore, there's no justification for restricting my freedom and forcing me to wear a mask when I personally am not a threat to anybody. Okay, so that's sort of the narrow harm principle in action there. Okay, so and this example illustrates that the narrow harm principle is just really unsuited as a principle for public health ethics. Nevertheless, you can find folks, and I think, I don't know for Ross, I'm sure if you're still on the call, this is a quote from your paper that you published back in 2002, Principles for the Justification of Public Health Intervention. This is a widely cited paper in the field of public health ethics. And Upshur says, the harm principle as set out by John Stuart Mill is perhaps the foundational principle for public health ethics in a democratic society. And then Upshur quotes the same passage from John Stuart Mill that I quoted earlier and gives a few examples. And the examples are always one where it's a particular individuals, and the question is, are those individuals posing a health threat to other people? And if so, is that health threat enough for the state to intervene to stop them from doing it? I think it's not totally clear to me from Upshur's paper whether he means the narrow or the broad harm principle. So I'm not going to make claims about what Upshur meant in his paper about those two different versions of the harm principle. But I just want to say that the narrow harm principle, I think, is not a good principle for public health ethics for two reasons. One is the one already illustrated here, and that is it basically just undermines collective action to prevent infectious disease spreads, because the whole idea of preventing spread of infectious disease, you want prevalence and incidence of the disease to stay low. But when it's low, the risk of any individual person is also going to be pretty negligible. In fact, zero for most people, because most people don't have it. And yet the collective action of, say, for example, collective action on things like vaccination or mask wearing or other things are required to keep that low. And it's not clear how the narrow harm principle really can justify any kind of measures that require people to do these things. The second problem, and this is more of a sideline for this talk, is that I think the narrow harm principle really makes it difficult to justify redistribution of wealth, and then therefore any kind of population health measure that involves redistribution of wealth, which any measure that involves, say, taxing people, and especially people who have more money, paying more taxes to support things like nutrition campaigns or publicly funded health insurance and so on, are going to be very difficult to justify given the narrow harm principle, which anybody who's read Robert Nozick's Anarchy, State, and Utopia would be familiar with the kinds of arguments about this. I'm not going to talk about point 2 so much here in this talk, though. All right. So what then about the broad harm principle? You might say, okay, so maybe the narrow harm principle, maybe that's not so good. So maybe when people talk about the harm principle in public health, we should just understand them to be talking about the broad harm principle. And in fact, the broad harm principle, as we've seen, doesn't hamstring public health. It doesn't, it's going to allow for things like mask mandates. It's going to be consistent with things like redistribution, because that redistribution could be preventing harm to others. And say, well, I didn't make those other people sick. Why should I have to pay taxes to, help them out to prevent harms to them? Well, the broad harm principle is going to allow the state to do that anyway. But I think if you're a liberal, you should really be a bit concerned about the broad harm principle. And in particular, the broad harm principle just seems to put no restriction, no limit on what the state can do to prevent harm to other people. And to see that, I mean, think of something like approaches taken to COVID-19 in China versus, say, in South Korea or in Taiwan. And clearly the approach in China was much more heavy-handed, right? I mean, if you had, even putting aside the case of Wuhan, which is different because of course there was a huge outbreak, but even other cities, if there were some just small outbreaks, a handful of cases, there would just be massive lockdowns of the whole city until there were just, the incidence was brought down to 0. And from a liberal point of view, you might think that's going overboard. Maybe it would just make more sense to have really, really aggressive and focused contact tracing, mask mandates, a number of other things, but not, total massive lockdowns until the incidence gets above a certain level. And it seems, for the purpose of this paper presentation, isn't to argue about that, but it seems to me that's a kind of view that a liberal might want to take, but it's not clear how the broad harm principle really explains that kind of argument or how it fits with that kind of argument. It just seems to say, well, if your goal is to bring the incidence down to 0 and that's preventing harm to others, then that seems to be okay given the broad harm principle. Okay, so that's point number 1. The broad harm principle seems to me a bit uncomfortably giving too much power to the state from a liberal perspective. The second concern is more specific to this example of mask wearing, is that the broad harm principle—
Daniel?
Oh, yes?
I don't mean to interrupt, but there was a question to clarify liberal, and I think you mean the political philosophy sense of liberal and not the...
yes.
Yes.
I'm sorry, yes, political liberalism in the sense of the political philosophy. Yeah,
thank you. Perfect.
So I could in the Q&A, I could be happy to talk about how the political philosophy sense of liberal and the sort of more political sense of liberal are sort of related to one another.
Sorry, I didn't want to interrupt your flow. I just thought that would help. Thank you.
Yeah. So so the second point that's more specific to this case is that I think the broad harm principle just doesn't capture this key argument. And this is there was I remember seeing. He was the governor of the state of North Dakota in the U.S. saying something like about he was enacting a mask mandate in a very conservative Republican state in the U.S. and was saying, well, look, it's not a big restriction on your freedom. It's not like we're taking away your right to vote. And so the key idea here is that wearing a mask is a small restriction on your freedom compared to other measures, and also just compared to how the uncontrolled spread of COVID-19 would restrict your freedom itself, right? And so that there's a sense of, well, it's a small freedom compared to these other freedoms that it's saving or helping to secure. And that aspect of the reasoning, it just seems to me, isn't captured at all by the broad harm principle. All right, so here in the last part of my talk, I just want to suggest an alternative approach for public health ethics. If public health ethics is going to be, for approaches that want to take a sort of an approach based in political liberalism. And that is to think about Rawls' equal liberty principle, or principle of equal liberty. And this principle says every person has the right to the most extensive liberties compatible with similar liberties for all. And A really neat example of this that comes up in a theory of justice is Rawls' discussion of political donations. And Rawls has this discussion about how it's legitimate for the state to put limits on political donations, and maybe even just completely, like really strict limits, and almost down to the point where it's, almost not allowed at all, and its campaigns are just funded through some sort of, some taxation. And his argument for this is pretty straightforward. His argument is, well, what will happen is if you have unrestricted donations to political campaigns, is that the wealthy people just dominate the political process. And this undermines equal freedom of all to participate in the political process. And you could argue that's kind of what happens in some places, including the US, and that undermines this equal liberty principle in his view. And so the key idea here is that the principle of equal liberty suggests that freedoms in one domain may be restricted to allow greater freedoms in another domain, or to allow or to maintain similar freedoms for everybody. And I think both of those lines of thinking are relevant to the mask mandate example. So I'll explain that in a moment. But before I go on, I just want to have a clarification. For those of you who are familiar with Rawls, you'll know that Rawls very deliberately did not apply his theory to health, and in fact sort of had an idealizing assumption that everyone was healthy, so he could just really focus on sort of political and economic concerns, which were really the sort of main focus of his theory. And so you might ask, well, is the principle of equal liberty really relevant to public health at all, given that? In response to that, I would say, first of all, there's a number of philosophers who tried to adapt Rawls' theory to public health. Norman Daniels is the most well-known of those. So when I'm thinking about Rawls in relation to public health here, I'm thinking of, an adapted version of Rawls' theory, such as that proposed by Daniels, not necessarily Rawls' own theory, which was specifically not about health. Another interesting point is that many of the freedoms at issue in COVID-19 are actually freedoms that are political freedoms. If you think of the freedom of association, I mean, this is precisely what, bans on, social gatherings and so on, what they're affecting. And even wearing a mask, I mean, in some countries, including the United States, mask wearing became this sort of politically charged symbol, almost like, wearing a red hat with the letters MAGA on them. And so given that, I mean, there's a kind of political freedom aspect to, being required to wear a mask when you go to the grocery store. So I think you could argue that the kinds of freedoms we're talking about actually are pretty similar to the kinds of freedoms that this principle was originally designed to deal with. And moreover, that the theory has been sort of generalized and adapted to cover public health as well. All right, so that's just to make the case that this principle, I think, is arguably relevant to public health examples like this one. All right, so once you've got if you're sort of following me on that line of argument that far, then here's my thought, is that the principle of equal liberty suggests a really simple, compelling argument for mask mandates, that the general mask wearing requirement is a small restriction of freedom that facilitates the maintenance of a much more significant set of freedoms, things like going shopping, operating businesses, et cetera. And ultimately, if effective, preventing really strict limitations on freedoms required by measures like lockdowns. And so that's just a really simple, straightforward argument that just sort of falls out straightforwardly from the principle of equal liberty, and from the fact that the principle of equal liberty is taking this sort of system-wide look at and asking, okay, what set of rules are going to sort of give us most freedom overall? Assuming that these rules have to sort of be applied equally to everybody, and that's giving the system-wide look like the broad harm principle does. But at the same time, it's doing it in a way where you're trying to maximize freedom as much as you can, and therefore you're also going to, as a result, imply restrictions on what the state is going to be allowed to do to people. So unlike the narrow harm principle, the principle of equal liberty does not prevent collective action or to combat infectious disease or prohibit measures that involve redistribution of wealth. And unlike the broad harm principle, the principle of equal liberty does put limits on sort of how far the state can go to restrict freedom. So for instance, it might prefer sort of an approach like South Korea or Taiwan to a really heavy-handed sort of immediate lockdown once you get a few incidences of COVID-19. All right, so just to sum up then, I think the case of COVID-19 mandates suggests that the harm principle is really a problematic principle of public health ethics. And so for those who wish to take an approach to public health ethics that's rooted in political liberalism, I think that, really they, and again, I should emphasize, I don't necessarily advocate a political liberalist approach to public health ethics, but if that is the approach you want to take, I think the principle of equal liberty from roles should be an alternative to consider.